Good to be back with you again. Today in the series of Hobson's Choice Modern Medicine versus Alternate Medicine, in the final video, we would like to arrive at what the option is for the public in the midst of this raging controversy between doctors of modern medicine and alternate medicine. And before we arrive at that conclusion, I would like to recap some of the high points. I won't be able to summarize everything. We would also look at what we have discussed already, what should be the responsibility of the government and the course of action that is open in front of them that will be for the best of the benefit of the public at large. And what should the doctors do in their individual practice as well as a group, especially their organization should be doing at this difficult juncture. And most important, what is the most intelligent choice before the public, if at all they have a choice? How can they make an intelligent choice? That's what the whole aim of this 5-part series of this video is about. I am giving you the link to my previous 4 videos. You can stop the video here and go back and see them before you go and see the rest of the video. And if not, at the end of this video, I'll be giving a link to all my YouTube videos, and from that you can navigate to these individual videos as well. In the previous videos, we had found that traditional medicine as well as CAM is becoming increasingly popular among the public all over the world, including developed countries. And that we also found that traditional medicine, WHO has a strategy which extends from 2014 to 2023 to include it in most of the national policies. On the top of it, in mid-2017, the WHO's Traditional Complementary Medicine Unit was renamed to include the term integrative medicine to cover the integrative approaches of both traditional and complementary medicine and conventional medicine regarding policy, knowledge, and practice. The unit is now officially referred to as traditional, complementary, and integrative medicine. Therefore, they have a policy not only for promoting traditional medicine, they are dead serious about integrative medicine. They want to integrate the medicine both in practice as well as in theory. To recapitulate some high points from the previous videos, we were really concerned about the regulatory and safety with respect to CAM therapies. This is basically because there is a general feeling among the public that the consumers considered by many consumers to be safe because supplements are natural. They can still be potentially harmful as a result of drug interaction, toxicity, contamination, and other dangers. And we have found out that in USA, where the statistics are available, a significant ER visits due to adverse events related to dietary supplements and herbal products are well documented. Therefore, they are not safe as the public consider them to be. Now, another thing which is concerned about the regulatory aspect, we noted that the pilot study is not mandatory. If any drug is mentioned in any of the books or in any of the journals, then they can be manufactured and marketed without any checks. And this is of considerable worry regarding the safety. On the other hand, even in Western countries, herbal medicines are considered as dietary supplements. Therefore, even in USA from 1992 onwards, they don't come under the FDA regulations. Therefore, now they are not considered as medicines. They are marketed as therapies in a subtle way. For example, in osteoarthritis, they may be marketed telling the patient's pain is better, he is feeling better, etc. And at the same time, they are not. Though it is not a medicine, they are not allowed to market it as a treatment of osteoarthritis. But at the same time, they do well in the market by this pseudo marketing techniques. So these are great concerns of modern medicine doctors regarding safety of CAM therapies. To recapitulate another important aspect, evidence-based practice, evidence-based medicine forms the core of medical practice today. The best research, available research evidence is taken into consideration. Usually it is randomized controlled trials or double-blind randomized controlled trials, meta-analysis of randomized controlled trials, etc. are considered to make guidelines which forms the essence of modern day practice. Now, many times when these evidences are not available, or sometimes clinical expertise is also taken into consideration. Always the patient's values and preferences are taken into consideration also. Now, one thing to note is evidence-based medicine is meant to complement, not replace clinical judgment tailored to individual patients. Similar evidence-based medicine and the delivery of culturally and socially and individually sensitive and effective care are complementary, not contradictory. This is the forms the heart of the practice today. In 2007, the poll conducted by the British Medical Journal, evidence-based medicine was included in the 15 most important advances in medicine since 1840. This is to just emphasize how EBM is so central to the practice of medicine today. Remember, from 1940, so many discoveries were made, like penicillin, discovery of multiple bacilli like tubercle bacilli, immunization, a lot of vaccines. Among all them, EBM practice is considered one of the most important advances in modern medicine. And nowadays, outcomes of well-designed clinical trials with a statistically significant difference between treatment modalities are sacrosanct for medical practice, not unreliable personal anecdotes. This forms the central core of the practice of modern medicine, for which no conventional medicine doctor will compromise with or should compromise. This is the heart of the reason why it is never possible, never possible to integrate modern medicine with alternate medicine for which there is no evidence. Now, what is the choice CAM has regarding EBM? They can accept EBM hierarchy and carry out RCT when possible. That is one possibility they can do. Now, they can accept EBM standard but argue the special characteristics of alternate medicine warrant the acceptance of lower forms of evidence. In fact, many of them argue that EBM does not apply to them. If you listen to the television interviews, etc., many of the Ayurvedic doctors, especially in India, say EBM does not apply to them. But most of the people in Ayush and WHO also understand, without some scientific backup, no system of medicine will have a future in the 21st century. Now, why are they telling that they can, what are the special characteristics they are talking about? They say their medicine is individualistic, holistic, and not all of them can be measured. Because in EBM, you measure mortality, morbidity, lowering of the platelet count, etc. I mean, coming back as early as possible, discharge, etc. But many things in alternate medicine, they are more concerned about whether the patient feels better. A feel-good factor is there. They say even if he is feeling better because of the placebo effect, they are happy about it. So these are the special things which they say, special characteristics of alternate medicine, which puts them beyond, in which EBM cannot be applied. But this is not accepted by the scientific medicine. Or they can challenge and work to develop new research designs and new standards of evidence that reflect their approach to medical care. Therefore, they can have their own evidence base. And in fact, this is what is now more and more people are going into this. So they choose the third option as far as alternate medicine is concerned. They say that for several reasons, the last option is preferable. First, it will be best meet the needs of alternate medicine practitioners. Re-evaluation of standards of evidence. That means what is evidence for us will not be evidence for them. Will benefit everyone in the medical community, including most importantly, patients. But I am sure this is not going to be accepted by the scientific community at large and by the practitioners of conventional medicine. Since WHO is pushing for integrative medicine, it will be worthwhile to see what they had to say about evidence EBM regarding this. They state that a knowledge-based policy is the key to integrate traditional and complementary medicine into national health systems. Research should be prioritized and supported in order to generate knowledge. No controversy regarding this. While there is much to be learned from controlled clinical trials, other evaluation methods are also available. Here is where the problem arises. They say that other than clinical trials, other evaluation methods are also available. If you look through their book strategy, you don't find them giving any details of what the other evaluation methods are. And remember that this is unlikely to be accepted unless it's scientifically proved by the practitioners of modern medicine. This WHO, one of the most important things they are telling is that they will help the individual countries to produce EBM in alternate medicine, because that is evidence is what is most of the countries are telling. 99 out of 100 countries have told them that they lack evidence-based policies for these alternate medicine, and WHO has promised to look into this matter, to help in this matter. But if you look into the past, the America, in the expenditure of approximately 2.2 billion by the National Center for Complementary and Alternate Medicine during the fiscal year 1999 to 2017, 18 years, they have looked for evidence in clinical trials, spent 2.2 billion US dollars. No sound, consistent evidence for the efficacy of any alternate medicine was found. Mind you, this has come in a 2020 scientific journal. Now, what is that the WHO is going to, how is that the WHO is going to help countries like India, Nepal, Bangladesh, etc. to produce evidence when so much has been done in this field? Now, if you look at international guidelines, majority, this is about NICE guidelines, complementary and alternative, more consistency and rigor are required. This is an article which came in British Medical Journal. Now, they say majority of international guidelines make no mention of CAM at all. As in most conditions, there is no evidence-based CAM option. When they do make a mention, they are vague and not backed by any good evidence. Therefore, when the international guidelines are of no help, when already much work which is done into it, spending huge amount of money has not produced results, how is that WHO is going to help the developing countries in producing evidence in the coming years? I was keenly looking for evidence for in EBM as far as Ayurveda is concerned, because that's a major alternate medicine practiced in India. I was very much thrilled when I found this in the net, especially when it was published by the General Council of Research Ayurvedic Sciences under the Ayush Ministry. And I was more than excited when they talked about some of the evidence emerged from double-blind, random controlled clinical trials and other efficacy trials. This is a 3-page document only. I just want to give you a taste of the evidence they are talking about by giving you one of them, because I don't have much time. Now they're talking in ischemic heart disease here. They're talking of Vaja. That is, this particular preparation was given 3 times a day and compared it with placebo. Significant improvement in symptoms like chest pain and respiratory distress was observed in treatment group. Therefore, when they gave it 3 times a day, and how long, I am not sure, they found out that there is a significant improvement in chest pain and respiratory distress. Mind you, they gave this medicine for ischemic heart disease patient with chest pain and respiratory distress. This would have been considered as an absolute emergency by the more conventional medicine doctors admitted in ICU, etc. How they went about doing this study is beyond my imagination. But anyway, to integrate this system of medicine with this evidence on modern medicine is almost next to impossible. After having got a taste of evidence regarding Ayurvedic medicine, let's look at what what evidence is there for homeopathic medicine. The general feeling is that in homeopathy, which says lights treat lights and dilutions increases potency, goes against the basic tenets of not only medicine, basic tenets of even science per se. Now, many people, however, very learned people also think that homeopathy is quite effective. Now, I will just refer to one article which came in the Lancet in 2005. Are clinical effects of homeopathy placebo effects? Comparative study of placebo-controlled trials of homeopathy and allopathy. Therefore, there is a direct head-to-head control study between homeopathy and allopathy. I would just like to read the statement. This finding is compatible with the notion that clinical effects of homeopathy are placebo effects. Therefore, world-famous journal has come to this conclusion. And remember one thing, homeopathic remedies have been exempted from 1938 from FDA regulations. Therefore, even if you get imported drugs anywhere from Germany or USA, homeopathic medicine, they have the backing of FDA regulations. Now, in 2010, the UK Parliament House of Commons Science and Technology Committee presented a report that called homeopathic remedies scientifically implausible and no different to placebos. These are the these are the medical systems which are going to be integrated with conventional medicine today. In fact, France has stopped reimbursing of patients for homeopathy. In a Guardian newspaper article which came in 2019, July itself, the French government has announced it will stop reimbursing patients for homeopathic treatment from 2021 after a major national study concluded that alternate medicine had no proven benefit. Note this, that a major national study in France showed that there is no alternate medicine had no proven benefit. Therefore, they stopped homeopathy. They don't say that homeopathy itself, all alternate medicine had no proven benefit. In Britain, the National Health Service decided in 2017 to stop funding homeopathic care, while public health systems in other EU countries such as Sweden, Belgium, or Austria do not support the system. Therefore, there is no government funding, no insurance covers this. In France, a major doctors group in France is pushing for the teaching of homeopathy to be stopped in university. They are going one step further and asking that the teaching of homeopathy be stopped. So far, we have been talking about, I was summarizing or some of the highlights of the first 4 videos. Now we come to the present video in which, from all this, what should be our basic approach of our doctors regarding our treatment in the 21st century, when there is a lot of pressure from outside to integrate the medicine, especially from the Indian government, the Ayush Ministry, as well as from WHO. This integration is going to take more and more importance. And what should be our approach? What should be our basic approach to this? I would go by the New England Journal editorial, which was published well back in September 1998. Each of these sentences are very important. There cannot be 2 kinds of medicine, conventional or alternative. You can only have a single system of medicine. It doesn't mean it's integrative medicine. What she says, there is only medicine that has been adequately tested and medicine that has not. Medicine that works and medicines that may or may not work. Therefore, once a treatment has been tested rigorously, it no longer matters whether it has been considered alternate at the outset. If it is found to be reasonably safe and effective, it should be accepted. They have written, it will be accepted. But assertions, speculations, and testimonials do not substitute for evidence. Alternate treatment should be subjected to scientific testing, no less rigorous than required for conventional treatment. This must be the heart of our practice, which we should all agree, or something called the fundamental rights. This should be the fundamental tenets of our practice, that anything which is tested, any intervention which is tested and proved to be effective and safe, whatever be the system of medicine we can practice. But if it is not put, and should be, the scrutiny should be the same, whether you call it conventional medicine or alternate medicine. There can be no going back on this basic issue. Now let's look at what's the best practice option available in the present circumstances for a conventional medicine doctor. Now the practice rational cost-effective treatment. What I'm insisting on cost-effective treatment is, there is a tendency nowadays in our own practice to put up the cost of our treatment, partially because we tend to prescribe more and more costly medicines, which has been promoted by pharmaceutical companies, and less costly medicine go out to the market. For example, I would say trimethoprim sulfamethoxazole is now not available for treatment of UTI, and we tend to write cefixime, pushing up the cost of a treatment of a simple condition like urinary tract infection. Today, even in NHS UK, where I know very well that trimethoprim sulfamethoxazole is the first line of treatment, but for us here, cefixime is the first line of treatment. Therefore, this is how you push up the treatment and cost of treatment unnecessarily. And we also try to investigate unnecessarily. Now, I will pick up an example. 40 years ago, for every epilepsy which used to come to a primary health center in the village, when the patient, it was anti-epileptic medicines were not available in the hospital. And when the patient, we used to write phenobarbital, and WHO even today says is effective in 1/3 of cases. Now we write costly medicines, ask him to do costly investigation, he goes away for CAM therapy. You can't blame him for that. Now, don't be dismissive if the patients are taking CAM medicines. If he says that he is taking CAM medicines, listen to him carefully. In fact, you should seek information whether he is taking CAM medication. And then only you can educate him regarding drug interaction, and you can give your opinion, whether you can give your opinion that it may not be evidence-based, etc. Now, if you are not ready to listen to him, he will withhold this information from you, and you will not be able to educate him. Now, very important thing is, you must take time to educate the rationale of your treatment. This is very important, which we fail many times. With the alternate medicine, doctors succeed very much. They talk to the patient for a long time, and this has a placebo and a soothing effect, and they tend to follow their treatment better than us. It's not enough that we write a prescription, but we should educate them, and whenever time permits, talk to them at their level. Now, here is something which I would like to differ from international guidelines. Restrict your practice to your field. Now, if you read American Academy of Pediatric guidelines, which I am not quoting, I am not putting up because of lack of time, they say specifically that you should seek information about CAM therapy and give that advice about them to the patients. That is something which I would never do, because how am I to seek information of CAM therapy, which is not my field of specialization? And India especially, there are doctors who are well trained in other systems of medicine like Ayurveda, homeopathy and Unani, etc. They are qualified, they are certified. I would advise these patients to go to them if they want treatment, to take advice from them. I would definitely say that please don't take combined medicines. Now, adequate documentation for medical legal issues, of course, are very important. In these circumstances, what should be the policy of the government? As far as India is concerned, this seems to be very clear. The government wants to merge allopathy, homeopathy, Ayurveda into one health system, and plans by 2030 have already been launched. The idea one nation, one health system has already appeared in Modi government's new health and education policies, and policies, and a committee has been formed to study its implementation. They were going in rapid pace to have a unified health system, a unified system of practice of medicine or integrated medicine. When the Indian government is busy integrating medicine, they should see what WHO, who also promotes integration, has to say about alternate medicine. I just draw your attention to 2 points. See, among other things, it talks of misdiagnosis, delayed diagnosis, failure to use conventional treatment. Therefore, this is described in the risk associated with traditional complementary medicine. Therefore, failure to use effective conventional treatment, delay in that, is another big problem when you try to integrate medicine. For conditions like myocardial infarction, patients with chest pain may be taking medicines in alternate time, and crucial time will be lost to save the patient. Another very important thing is exposure to misleading or unreliable information when you integrate medicine. For example, homeopathic medicine, if you take one example, homeopathic doctors are dead against measles immunization. And measles immunization is one of the most life-saving immunizations available in the present day world. Therefore, even the WHO has warned against these systems, and the government should be aware of it. One of the primary duties of the government is to ensure access to affordable and evidence-based medical care, at least at the primary care. Now, one of the reasons quoted by WHO and other organizations for promoting alternate medicine is because that's the only thing that is available in the rural hinterlands of many developing countries. But that should not be an excuse in the 21st century. Affordable primary care, which is making it access to the public, should be one of the fundamental rights of human beings in the 21st century. And WHO should not allow governments to escape from that responsibility. Now, you don't expect governments not to support alternate medicine, though they may not be evidence-based. For example, in India, Ayurveda is 3,000 to 5,000 years old, and definitely lot of people tend to take those medicines. But it must be the duty of the government to educate them about the risk and benefit of alternate based medicines based on evidence, if at all that is available. And the most important thing they should do is never try to integrate medicine. If they try to integrate medicine, it will cause more harm than good, as we have already seen. Now let's look at what the Government Doctors Association should be doing. In fact, the Indian Medical Association, which has a maximum number of allopathic doctors, or what they call it as modern medicine doctors in India, they have taken a very rightful and correct stand. They have made they say when one tries to provide access to healthcare, it is imperative to maintain quality. When the standards of care have to be ensured, there is always a cost. Government's urgency and anxiety in providing minimum care to all is shared by the Indian Medical Association. Unfortunately, IMA's concerns on standard of care appear to be not shared by the government. This is a very correct stand they have taken, and it goes to the heart of the matter. And they should be congratulating for taking this stand, which many other associations like the Indian Academy of Pediatrics, Physicians Conference Association, etc., have not taken a stand in this regard. What I'm not sure is whether the IMA realizes it's going to be an arduous and long fight. And we have to explain it at a reasonable and intellectual level on all, not only at the level of the patient, at the level of the governments, at the level of the intellectuals in the community. And they have been using the terms like mixopathy, khichdi. Mixopathy means you are mixing medicines, will not work. When WHO has a plan for integrative medicine and camp popularity is on the rise. In the community, CAM is, if at all not on rise, if not rising, it is definitely very popular. And there are many intellectuals who are questioning the arrogance of the modern medicine doctors in questioning other systems of medicine. Now, the patient education on the rational or present day treatment is the key. The doctors in their own practice have to change in many ways. They just a prescription will not do like in old times. They have to educate them on the rationale of the treatment they are giving, be open to questions from them, and have time for them to answer to that. And if you don't do it, the patients will not ask you questions, have their doubts, and go for alternate system of medicine. Now, in India at least, the IMA has been stressing the dangers of alternate day system of medicine doing surgery, because the government of India has foolishly started putting Ayurvedic doctors on modern medicine hospital to be trained for surgery. And they put a system of about 80 or 90 conditions in which they have to be trained. Now, this is a huge blunder which they are doing. I don't know whether the WHO is backing them on that. But that alone is not the reason. The lack of evidence base is a central issue which we have already seen why doctors are opposing this matter. And that has to be explained to the intellectuals, to the bureaucrats, to the public at large, and the politicians who matter. Therefore, what's the patient choices that is available in front of them? That's the final, we are coming to the final stages of this presentation. Now, WHO also states, and it should be obvious to anybody, that informed choice is one of the cornerstones of good healthcare. And in many member states, they also accept the fact that self-selection by the patients between traditional medicine and modern medicine takes place. Now, and they also say that can make informed choices about self-help care, but they say it's important to note the consumer's desire for accessibility and availability may conflict with the government's mandate to protect its population by adopting a precautionary principle when the risk is unclear. Actually, the risk is unclear when you take alternate medicine in most of the circumstances. And it's very difficult to understand how the patients, when the informed choice they can make when there's not much information available. Therefore, this is a very difficult question actually. If you look at one side, as far as scam is concerned, you have a traditional and considered safe increasing popularity and availability among the population. Now the people think that this medicine is traditional and can be considered safe because their fathers and forefathers grandfather would have taken the same medicine, and they think it is absolutely safe, it is correct, it is right on their part. And not only that, we have seen is increasing popularity and availability all over the world. Most important, the stamp of recognition is given by WHO and governments. If I am just showing to you what crosses the mind of the patient when he makes a selection, but it is not evidence-based. But this is not very clear. It is not in the for the patient to realize it, that it's not an evidence-based medicine. They think it is safe, but we have seen that even herbal products have drug interaction, delayed definitive treatments. Now on modern medicine part, we would say it is evidence-based. This might be very clear to the practicing doctors, but may not be for the patients unless you talk and educate them. It may not be even evident to the policy makers and politicians and even the health secretaries, etc. Now, one thing you should understand, the impact of health in modern, the only medicine which has made an impact on the health, public health over the centuries has been modern health, whether it is the eradication of smallpox, control of infectious diseases, immunization. In public health, the only medicine which has made an impact is probably modern medicine. But these may not cross the mind of the public at large unless you educate them regarding them. Now I would put this in amber, that is side effect and toxicity. Yes, there are side effects and toxicities in modern medicine, but it is not that only they have it, CAM also has it. As far as modern medicine is concerned, even the rarest of rare side effects and toxicities are well documented. Now, one of the things which we are also partially responsible in the cost and availability. The patient has to, many times in third world countries, they have, it is out of pocket treatment, treatment for the poor patient. Therefore, and when the cost of the medication is going up due to multiple reasons, some of them artificially, this becomes a difficult choice for the patient. Now, what is the choice available to it? It is an Hobson's choice as far as we are concerned. Hobson choice means practically there is no choice. Before us, it is take it or leave it. Take the modern medicine or leave it. But that may not what we have to educate the parents and give them the choice. And if they go for the alternate medicines, right, they may go for comforting lies if you don't educate them to unpleasant truth. Because when you say all the ifs and pros and cons, there are going to be unpleasant truths in whatever treatment you give. There might be side effects, there may toxicity which you might have to explain. While the alternate medicine doctors might say everything will be fine, then they might choose the comforting lies. Therefore, there is a very thin line how you can advise the patient and make them do the right choice. And the patients should, on their own, make an intelligent choice. Informed choice, when there is not much of information, is a very difficult aspect. Of experience in this field is, I would tell the patient, reveal all information, including all therapies, to your doctor. In fact, I would say that in India, in private practice at least, patients give more respect to the doctors than is due, though there are exceptions and a lot of violence is taking place now. Therefore, they are afraid to reveal that they are taking other therapies. In fact, they should reveal, and the doctor should be receptive of whatever the patient says. I would advise the patient to discuss his illness and medication with your doctor. He should discuss his illness and the medications he takes already taken with the doctor. And he should get information from authentic sources. Internet is a very good source, provided you get authentic sources like the Indian Academy of Pediatrics or the American Academy of Pediatrics or the NICE guidelines. All of them have patient education pamphlets which can be read. In fact, the doctor should be printing and giving it to them from their own hospital. Now, this is the most important fact. Do not hesitate to clear your doubts with your doctor. Now, I tell them to my relatives also to clear their doubts as and when with the doctor, not to ask a third person. The doctor should also be open to this. Now, many of the patients, in fact, even now, many patients come back and tell me, oh, the doctor has no time. There are 40, 50 people waiting for him. This might be true in government hospitals. Even in government hospitals in Kerala, I find patients do have time, and if appointment system is given, patients can be taught. There will be time for the doctors at not all times, but at least in between two consultations to educate the patients. And I would also advise the patients that if they go to a doctor who's too busy to listen to them and talk to them, better change the doctor. Because there are enough specialists around. It's better to have a doctor, even if he is less trained and less experience, who can spend more time with you rather than to go to a very well-known doctor who doesn't have any time to explain things to you. Therefore, these are basic things which a patient can do. And regarding the choice between modern medicine and alternate medicine, I would advise the patients that if you are taking an alternate medicine, please discuss with your Ayurvedic doctor or the homeopathic doctor what evidence is there to back up their treatment, and check it out in the websites. This is all I can help you with this. Therefore, the reading is on the wall. That is the only medicine, only systems of medicine which have undergone the scrutiny of evidence basis or scientific scrutiny is safe and effective. Nobody can escape from making a choice between modern medicine and integrative medicine, as well as choosing your doctor. This is not an easy option, considering the fact that an informed choice can be made only if there are proper informations available. and proper informations are very difficult to get, and impartial ones are hardly ever available. The public is at a loss. And if I have helped you in some way to make a better choice, I have succeeded. That was my effort in making this video, which has 5 sets. And this is the last one of it. My other educational videos can be found in this YouTube site, and I also blog on this wordprocess.com. Thank you for listening to me so long. Goodbye till we see again next time.